All right, that looks like it's getting there. Okay, great. Thank you, everybody. Want to welcome you to our Wednesday Wildlife Wanderings, and today for our third installment, we are going to be speaking with Trina Noonan. Trina is the Managing Director of Health and Harmony. Welcome, Trina. It's really great to have you here.
Hi, yeah, thanks so much for having me. I love the Seneca Park Zoo. Glad to be joining you guys remotely today.
Great, thanks. And so you're the Managing Director of Health and Harmony. What does that really mean?
That means a lot of things depending on the day, but by and large, I focus on the fundraising and communications and marketing, and as well as the finance and administration, human resources, that kind of thing. So the kind of sides of making everything run of the organization.
Yeah, and as we're speaking today, making things run right now is boy, it's a handful. And as we've talked, I've been very lucky, or I feel very lucky, because over the past several months, you and I have gotten to know each other a little bit better. And I think every single time we talk, we're expecting it to be maybe not so long of a talk, and we end up going down some rabbit hole talking about data or how we can prove impact or really measure what reforestation means. And so in that regard, I'm incredibly lucky and thankful for that. You know, Health and Harmony is a growing nonprofit, and it's a nonprofit that really impressed me early on because of the data that you all collect and the way that you use data to tell your story. So we're very thankful for you coming here today to tell us what it's like in the current climate working in conservation around coronavirus and around the many places that you work throughout the world. So I will go ahead and let you share your screen and go over into your PowerPoint or your presentation if you want to, and we will get started. So thank you very much again for coming, and we will get started.
Yeah, thank you so much. So I just hit start on this. I just wanted to share, let's see here. Now I am, let me just make sure that I'm playing this correctly. Everybody can see, you can see here, Tom?
Yep, you're good. Go ahead.
All right. I'm just missing my notes somehow. Sorry about this.
This is why we get the content experts, because you can go all day talking about it. So if you don't.
Yeah, exactly. For some reason, I'm just not able to get the view right here. Sorry about this.
That's right.
Oh.
While you're doing that, I'll let everybody know we've had a long relationship with Health and Harmony at Seneca Park Zoo Society. As Trina mentioned, she really has a good relationship with the zoo, and Dr. Jeff Wyatt, our former veterinarian, is on the board for Health and Harmony. And I know that we have some docents in here today that have known your organization for quite some time as well. So we're, again, incredibly thankful for you to be here and looking forward to future partnership activities.
Yeah, absolutely. Visiting the zoo, I think it was back in 2015 when I was there in person, but that was just one of the greatest days to get to see the zoo, and yeah, I had a great time visiting there.
You have to come back when we reopen the front of the zoo and get that construction done for sure.
Yeah, absolutely, and we're just so grateful and safe for the partnership with the Seneca Park Zoo. And yeah, I think I've got my slides going now.
Okay.
So sorry about that delay.
No, that's great. No worries.
But yeah, I just wanted to talk a little bit about Health and Harmony's coronavirus response today. I know, like Tom was saying, a lot of you may be familiar with the work that Health and Harmony is doing. So I wanted to give a bit more detail on what we've been working on over the last couple months, and specifically the ways that we've been trying to make sure that our conservation goals are still moving forward, and that I think right before we started this, Tom, you were saying that conservation work and climate change isn't put on pause because of this coronavirus pandemic. And that's something that we're feeling is very real. And so we want to try to figure out how not only we can support the communities that we're working with through the health and economic impacts of this coronavirus, but how we can support the rainforests through the conservation impacts that potentially could come out of this coronavirus. So just to give a little bit of background on who Health in Harmony is, we are a 15-year-old planetary health organization, which means that we're working at the intersection of human and environmental health and recognizing that people and ecosystems need each other to thrive. So practically, this means that we work with teams in Indonesia, Madagascar, and hopefully soon Brazil to implement the solutions that communities tell us are needed in order to stop ecosystem degradation. And that's a huge part, that's the cornerstone of our approach, is doing this radical listening method that generates solutions from the people who are closest to the issues, which is the communities who live in these rainforests. And most often this means quality and affordable healthcare and sustainable livelihoods. So we've had really remarkable success because of this community approach, improving human well-being and also regenerating invaluable habitat for endangered species like orangutans and now lemurs. So as one of the few organizations that's really working on this connection between human health, livelihoods, climate change, we've been able to respond really quickly and even accelerate some of our programming during this pandemic. And I want to start with a quote from our executive director. He recently was saying that truly the coronavirus is actually a symptom of a sick planet, and planetary health is the cure. And what we mean by planetary health and planetary health response is that if we're successful, our work is going to be improving both human health and well-being and the integrity of rainforest ecosystems, which human health depends on, and which of course are hugely valuable for these endangered species. So again, today I'm going to talk about our medical response in Indonesia and Madagascar, because that is so integral to the health of these ecosystems, and also talk about the conservation stimulus that we've started. So donors have responded really quickly and generously, allowing us to equip our staff, focus on massive prevention and public health efforts, and advocating for planetary health at the central government level, while also providing support to families so that they don't have to resort to degradation during this, due to the economic impacts of this pandemic. So I'll start with some of the highlights from Indonesia and just click through some of these pictures here. First off, our former executive director of the organization that we work with in Indonesia, ASRI, her name is Monica, and she had actually just graduated with a public health master's degree from Harvard in January of this year and returned to Indonesia, which put her in this very unique position of being perfectly positioned to talk about the impact that the coronavirus could have, and especially on Indonesia. And so she started kind of sharing what she was learning on social media. That quickly went viral, and she began to be invited into conversations with the central government about how to prepare Indonesia for the coronavirus. So that's been hugely helpful and hopefully quite beneficial to their response overall. Thinking, we've thought a lot about prevention, and obviously these are our staff members wearing PPE, and we've really adjusted patient flows and how patients are received at the clinic and tested, temperature taken right at the beginning when they get there. We've also done a lot of public health outreach and focus on prevention. So we've been working on an SMS campaign to the patient phone numbers that we have in our database to talk about symptoms, talk about what resources are available, and we're starting to really try to work as much as possible on some of the stigmas that are existing around coronavirus and stigmas around healthcare workers and patients, and try to help reduce those as much as possible so that people are seeking out the help they need if they are ill, and taking care of people who are ill. We've also done a lot on social media, posters, radio interviews around the community, and let's see, I've got a great picture here. We did a mask making campaign. So not only did this provide livelihoods for some people who may have been out of work at this period, but we made over 1,000 masks and distributed many of them to government facilities, along with gloves, PPE, gowns, face shields, all kinds of different supplies, because Austria was able to be prepared so early, and the government, some of the government facilities were not able to prepare in that same way. And so now we've been able to help and provide this kind of regional response and government partnership that will really be strengthening the system for the whole region, healthcare. We've also been working with our forest guardians, who typically are working in their communities and with loggers directly, trying to transition them to alternative livelihoods. But we've been providing them with as public health ambassadors during this time, so that they, as the local representatives within the villages around the national park, they can be providing the most important information about hand washing, social distancing, all of the same things that we're talking about here. And then this is a picture from our second site in Indonesia, Bukit 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 Raya. And this is an extremely remote community. So they have been responding by really trying to stay as isolated as possible, not letting a lot of outsiders in during this time, including some of our staff, except the staff that was already there and embedded in the community. We've set up hand washing stations, done a lot of demonstrations, made sure that each person coming into the clinic is washing their hands. And again, doing a lot of public education about symptoms and transmission, and how to actually take care of this disease if you are feeling ill. So just again, a lot of additional cleaning. We've turned our security guards into temperature takers, and helping with cleaning and sending out information into the public about proper mask usage. I believe that this says something to the effect of use this mask to cover your nose and mouth, but don't cover your heart. Like, keep your heart open to the people who are responding to this virus and taking care of patients, right?
Trina, do you have any sense as to, we work in Madagascar as you do, and we know that one of the problems there is testing. Like a couple weeks ago, Madagascar could only do like 200 per day
Right.
throughout the entire country. Is that the same story here?
Yeah, so I know that Indonesia, or at least this part of Indonesia where we're working, they have had access to tests. It's not on a massive scale, but people who have had symptoms have been able to get tested. And so I know that we've been able to do, for the cases, we have one family who's tested positive for coronavirus in Sukadana so far. And they've been able to do both a rapid test and then, I'm not sure the exact name of it, but a kind of more accurate, longer test a couple times throughout this, to make sure that they are not continuing to test positive, and they've been testing other family members. So I think there's some access to testing, but it's certainly not widespread. It's not the same, it's not the contact tracing and proactive testing that we'd be hoping for. Yeah, and in Madagascar, I'm pretty sure, I'd have to double check with my program director, but I believe that there's just really not a lot of testing capacity at all locally where we're working in Farafangana.
Right, and the hardware is a problem in Madagascar too. Having the intensive care units. In fact, I think I recall the number was something like 12 through the entire country, and they were all in Antananarivo, which is the capital city. So I'd assume that it's at least on some scale about the same as that in some of these rural areas of Indonesia. Yeah.
One of the things that we were just talking about last night is actually some different ways to not test for the virus, but can test, if you can test the blood oxygen level, that's one of the clearest indicators of when somebody needs to get medical attention. Right. So that's one of the things that we're focusing on in Madagascar, is testing that blood oxygen level and saying, okay, you can stay home, you're not that sick yet, but you really need to go and get care. And that if we can triage, we feel like that's one of the most important things that we can be doing during this.
And you can certainly scale out blood ox testing much easier than all
Right.
of this. It's a very easy test for those that don't know. There can be a finger clamp. There's a couple different ways to test that, but it's an instantaneous reading and something that can be an indicator for sure.
Right. Exactly. So actually, yeah, shifting to Madagascar, we've been doing a lot of similar work there, but really focusing on working with the regional government. And we've been able to accelerate relationships with the government by being one of the organizations that's actually showing up and participating and supporting their response. And I should back up and say, we just started our partnership with Madagascar in the fall of last year. So we were really just in the beginning stages. Right before the virus started hitting, our program coordinator was in Madagascar doing our initial rounds of community meetings and signing MOUs with the communities about what the conservation healthcare work would look like. And that was in February. So we're really just kind of starting these relationships. And so being able to work so closely with the government right now, like I say, is accelerating those relationships. We just got some important paperwork signed last week that will help us now implement mobile clinics, which will be a huge part of our response there. But again, in Madagascar, we've done a lot of trainings. We've worked with the local, we've done assessments of the local healthcare outposts. We've done soap distribution. This is a photo of a checkpoint on the road coming into Farafangana to be doing temperature checks. Here's the training that's been happening with some local healthcare workers on proper PPE use. We've been doing a lot of door-to-door information sharing, handing out soap and sanitation supplies, providing training to healthcare providers. So it's a lot of proactive preventative measures there so far for community health. And then I'll talk some about our conservation stimulus. So I've been talking a lot about healthcare, which is probably interesting for a Wildlife Wednesday, but we know that healthcare has been a driver of logging, especially in Indonesia for the last 15 years. And now we're worrying especially about economic recession. There's an article, several articles about a study that was done recently that shows that about 500 million people could be pushed into poverty because of this pandemic. And so we really want to be working with the people who are most at risk of moving back into or accelerating degradation at this time in order to pay for whether it's healthcare or just, for example, we've been working on buying chainsaws and providing business startup loans for a lot of the remaining illegal loggers in Indonesia. And, these are all, so we have a cohort of 140 people who have businesses that are a couple years old, they're just getting off the ground. And if those businesses now are not able to function, then those people won't have a lot of livelihood options other than potentially going back into the forest. So we've been tiering this response on people who are most at risk. And in Indonesia, that means we've been focusing on the farmers, business owners, and people who are still actively logging. So we're ramping up funding now to buy additional chainsaws. We're providing new business opportunities in growing seedlings and starting nurseries, and with a commitment that we will buy those seedlings to use in our reforestation work, and purchasing produce from organic farmers who have lost their market. And this has the add-on benefit of we'll be able to provide nutritious food to the people who are most vulnerable in these communities as well. And then in Madagascar, we'll be starting to implement the conservation programs that the communities most requested. So again, seedling nurseries and all things that can be done still safely and at appropriate proper distance. We're doing some rice cultivation and agriculture, building fire breaks around the vulnerable parts of the forest, and implementing reforestation.
Great.
And I think, that's kind of what I wanted to chat about, and hopefully I'm leaving enough time for questions here. But.
Yeah, I think we've got just enough. So we've got about 10 minutes. So I'll come back to this view here, and let me open up our question and answer area. As we get started here on our Q&A, You know, I just in broad generalities, again, as a reminder, anybody has questions, please click the Q&A and you can type them in there. As a broad generality though, data is again, I'm going to bring that up because I think that Health and Harmony probably does that the best out of any nonprofit that we work with at the zoo. And it was certainly something that actually it was probably your trip in 2015 that I actually recall seeing a photo of an orangutan using one of the corridors and going back to an island of trees. And I can still remember 68% less logging in 4 or 5 years with your Goats for Widow program. And it's very guttural and it's very, you know, limbic brain when you can really think like 68% logging in 4 years. Can you just speak a little bit to how you all think about using data to create the story and tell the story of Health and Harmony?
Yeah, absolutely. I mean, like you say, we do focus on data a lot. We're an organization and a staff who's extremely driven by the challenge of climate change. And we are very aware that there's only about 10 years left at this point to really be drawing down a significant part of the carbon dioxide within the atmosphere. And so we want to be doing things that are working and we don't want to be doing things that are not working. And I think that combined with this radical listening methodology that I've talked about a little bit, it's just that we want to be making sure that we're making an actual difference in communities' lives. We're doing the things that they believe in, that they've designed, and also things that are having an impact on the rainforest, the ecosystem, and the amount of carbon that's stored. So you're right. We, you know, our founder put in place as part of our startup a baseline survey, and that's something that we've been able to return to and compare against. And now that is actually 90%. We've seen a 90% decrease in logging households in the last 10 years, which is pretty incredible.
That's amazing. It's truly amazing.
It's yeah. I mean, and we can kind of independently verify that with increasing use of satellite data on the rainforest itself. And we've seen, still early for me on the West Coast, so I'm going to mix all my numbers up, but about 52,000 acres of regenerated forest in this Untitled National Park over the last 10 years as well.
Phenomenal. Congratulations so far.
Yeah, thanks so much. So we really want to combine that with the data on healthcare and on livelihoods as well. And, you know, we look at both things like reducing infant mortality, occurrence of common disease indicators, but also people's more kind of intangible but still measurable things like the economic security that people sense in their households. You know, if people feel like they will have to log the forest in order to pay for healthcare costs, then that's an issue. But if people feel like they have the safety net of being able to put down that chainsaw and actually move into a different livelihood, then that is success.
Well, Yvonne, one of our attendees, actually just asked the question that I was already going to ask next, so I'll bring that up. You talk about carbon sequestration, right? And we spoke briefly before we started this that I read the headline and haven't read the article yet, but it says 17% less carbon emissions since coronavirus since it started, right? So this is a starting off point for people like you and me, right? And it's something that we can really grab a hold of and try to harness in order to move forward, to get governments to change and cultures to change and continue this trend. Just what are your feelings on seeing that 17% decrease, and how do you think that as conservation organizations we can harness that and really, you know, keep it going when we come out of this?
Yeah, that's a really good question. I think, you know, we're all asking ourselves, I think first off, that's providing a huge amount of hope. That's providing hope that about nature's resiliency and about how quickly we can make change when inspired to do so, and that change is possible even for our climate. But obviously, this isn't going to last forever. At the same time, and we wonder how quickly those gains could be reversed, especially if we're trying to really push economic activity in the coming months to make up for the last few months of shutdown and quarantine. So I think that's, in some sense, is a very unanswered question. But I'd say at Health and Harmony, we're really hoping that this time is a beginning of a great turning, where humanity begins to truly understand our connection with natural ecosystems, and understands that we have to live in balance with each other in order to safeguard our own health, safeguard our own well-being, and our own economy. So we're hoping that this will be a time of inspiration and true systems change toward a more equitable, just, and healthy planet. And I think that that's very possible.
Yeah, I have to think that it's some of these photos that you see of city skylines that you don't see anything, or the Himalayas, from a city that hasn't been able to see it in 30 or 40 years. I sometimes sit here and wonder, what's going to happen when we do start getting back, and is somebody going to wake up one morning and say, oh, it's just not there again, and go about their daily life? Or are they going to wake up and go, oh, it's not there again, we need to do something about this?
Right.
Yeah.
Yeah, I totally agree. I think that, I think I was just talking to a board member last night who's saying she's been getting pictures from family members in Jakarta, and they can see the mountains beyond Jakarta for the first time, and she hasn't seen that in 10 plus years. And so I think that is really affecting people. People are noticing that. And at the same time, not to bring it back to a negative, but there are huge challenges to the environment right now. And we're seeing in places like Brazil, they've measured upticks in deforestation during this pandemic. And I believe in Indonesia as well, there's been, or potentially Malaysia, I was reading an article about upticks in deforestation during this time, as maybe policing has been decreased, or people, we've seen from communities that we talk with in Brazil that as the coronavirus makes bigger inroads on these really remote communities, they're having to leave their land, and they aren't there to protect it from encroachment from cattle ranchers or agriculture. I'm getting too far down the rabbit hole.
I know this is what happens every time. We'll be like 3 o'clock and only one person left in watching us. So to wrap this up, planetary health is not just human health. It's not just forest health. It's not just animal health. It's all of it together. And I thank you for your messages today. I do think that I do really hope that the hope is the message that people take out of this and see that, really in 2 months' time, we radically changed carbon emissions and pollution levels and amount of emissions and trash going into the environment in ways that I think probably as a society we may not have thought we could. So while you're correct, there's a whole lot of bad with coronavirus. Hopefully we take something out of this. And I want to thank you for coming in today. Healthandharmony.org is the website if anybody wants to check it out. They have a great carbon sequestration program and tremendous work in Indonesia, Madagascar, and other places, hopefully soon. So thank you, Trina. We really appreciate you being here. Any last words for our attendees?
Oh, just thanks so much again to the Seneca Park Zoo for all the ways that we've worked together over the years, and hope that we can keep that going. And you guys, I know, are getting ready to open again at some point in the future, and just best of luck with that and all the work that you guys are doing.
Great. Thank you, everybody, for coming in. Next week, we have Otter Day at the zoo, so we will actually have 2 of these where we speak specifically about otters. So thank you again, Trina. Keep up the great work that Health and Harmony is doing, and best of luck in the future.
Thanks so much, Tom.
Thanks.